Kia ora koutou, I'm Sarah Tuck, one of the co-founders of Coliberate. Coliberate's purpose is to enable the mental health support capability of everyday New Zealanders just like you and me. We do this in two ways. The first way is empowering people with the skills to be able to be really good first responders for people in their community and in their environments and workplaces who are experiencing distress. So you are equipped with everything you need to be able to provide that first-hand support and to connect that person to further support, whatever it may be. And the other way is that we're building a big wellbeing gym right in the middle of the city where you can come along and build up your own tools for your own well-being, build personal well-being strategies, connect with other people, feel a sense of connection, belonging, and anything that you need to help you feel well. We have a really cool team. It's a small team of a few core people that are making our day-to-day operations go, and then we have a whole bunch of facilitators that go out all throughout New Zealand and deliver the course. Me and my two co-founders, Jodie Burrell and Bob Murdoch, set this up about 5 years ago. Now it's Bob and I who are managing directors of the company, so we're kind of running the day-to-day things. All of us have a huge sense of purpose and connection to furthering the impact of the organisation, and a lot of us are driven by this purpose, which is to ensure that every single person has a trusted someone that they know they can rely on to reach out, see if you are okay, and connect you to further support if you need it. We work in service delivery, and it's really important to us that we have a high quality of service and delivery, especially working in training people to respond well to mental health and well-being. We think it's really important that it's done really well. We go into organisations to deliver these courses in groups of 12, usually for people leaders or managers or anyone within the organisation that you know is supporting someone in that way at work, with the outcome to keep people in work. Our impact model is we sell services to organisations, train them with the skills. That creates a sense of impact within that organisation, and then the profits that we make gets reinvested back into delivering the service into organisations that can't necessarily afford it, so we can keep on making an impact in areas where it's most needed. So we work with a whole range of people all throughout New Zealand. A lot of those people are within organisations, but we also work with people from the public. You can come along to any of our public courses at any time, so anyone in New Zealand can access them. The organisations we work with range from big private companies like Vector all the way through to government agencies like NZTA or MSD, all the way through to small organisations or growing organisations too, like Garage Project and some local businesses. Me and my two co-founders, Bob and Jodie, we actually started out making theatre. So we had a theatre production company called Pat a Cake Productions, and we'd make these epic theatre shows. And we didn't necessarily work with actors, we would work with people who just wanted to be involved in something. So we would create these big collaborations, and the shows were kind of all sorts of topics. We did one on the housing crisis, we did one in a moving bus that went all throughout the city. It was super promenade, and there would be things happening on the outside that would influence the journey. And the thing that we loved about creating theatre is that the process harboured this sense of belonging and purpose and connection, and we didn't really know at the time. We called it the magic sauce because it just kind of created this sense of well-being in people that we couldn't really articulate. And it was at the end of one of these shows that we were making where because we worked full-time jobs as well as making theatre basically full-time, and we were like, how can we make our theatre production company more financially sustainable so we could actually get paid for the work that we're doing, and knowing that this is having a really big impact on the people in the room, how can we actually invite others that don't necessarily connect with making theatre or want to be an actor, how can we invite them into this sense of community and belonging and purpose? And so this opportunity came up, and we ended up applying for this accelerator program. We got in, and we went in with the purpose to make theatre more sustainable, and what we came out with was Coliberate, which was all around people sustainability and how can we set people up to be able to make the most out of their lives. I think one of my favourite moments that has happened in the company so far, especially one of our impact moments we talk about, which is when we started delivering mental health first aid and rolling that out. We didn't really know how to measure its impact or what the impact was having. One of the people that we trained got in touch and shared this story in which the training had really helped her get someone else the support that they needed. She just happened to be on a plane, on a flight, and the person next to her was having a panic attack, and she could recognise it basically because she'd just done the training. And she took that moment to ask that person if they were okay and if they needed anything, and ended up de-escalating this person in their panic, and then having a conversation with them to get them to look at further support options, or whether they needed more support, or whether it was usually just on aeroplanes that this happened. And she wrote to us being like, I wouldn't have known what to do, and I would have ignored this person if I hadn't done the training. From the get-go, we were always impact focused, but we didn't necessarily have the language around social enterprise, what it meant to be impact led, and what it meant to turn your profits into doing more good or making more impact. I really love being a social enterprise. In New Zealand there's no company structure for a social enterprise, and so we've really had to navigate what we are structurally, and then what story do we present and how do we present externally to know that we are actually impact led and not just operating to make a profit off people's well-being at all. So I think being a social enterprise really helps you engage in a narrative that's more around doing good rather than making profit. I think for a long time we were quite stuck with how we actually measure our impact, knowing that our narrative was all around, we're an impact-led organisation. People are like, well, how do you measure that? And being a service, it's really, really hard to tangibly create evidence without someone doing a 5-year study on your organisation to actually create substantial evidence. It's been a really great learning journey how to actually measure that. We put out an impact survey of all of our trainees a few years ago, and out of the people that responded, which was quite a large percentage, like 35% of people trained, and out of those people, they said that on average they have, it was like 2.2 mental health first aid response conversations each week, and a lot of them said that these conversations had definitely connected people to further support, had definitely improved lives, and some of them had even saved lives. And I think when you multiply that number by the amount of people we trained, that equals now to about 300,000 supportive conversations that are happening every single week. Now that average number has increased from 2.2 to 3.7. So one person said that they have 100 conversations per week. There's that saying that's like, people don't necessarily remember what you said, but they remember how it made you feel. We get a lot of feedback around just the feeling of hope, inspiration and empowerment that the course brings tends to mean that people are more likely to remember their skill set and be able to use them when required.